So my name is Emily Mwakalinga. I'm a third-year radiology registrar under Kamuzu College of Health Sciences, currently working at Queen Elizabeth Central Hospital. At the moment, I've been to one district hospital, which is Mulanje District Hospital. So this hospital sort of serves the rural and semi-urban population. It's got a total population of about 8,000. So this hospital acts as a secondary hospital. So Mulanje District Hospital has got only ultrasound and radiography imaging services, that is in terms of just X-rays. So they are missing another very crucial component of imaging, for example, the cross-sectional imaging. They do not have any CT scan and they do not have any MRI. Even though we talk about availability of the ultrasound services, this hospital only has 2 ultrasound machines, of which one of them is the one that works like it's in perfect condition. So the other one, it's an on and off machine. So already they've got one proper functional ultrasound machine. In terms of X-rays, similarly, they've got 2 X-ray machines, but only one is the one that is properly functional. The other one is on and off. So really, they've got limited imaging equipments. As big as that hospital is, serving that big population, just relying on one proper ultrasound machine is not adequate, and the X-ray machine is also not adequate. Just to add on that, there is also limited number of radiographers that provide these services. So this facility only has 4 radiographers that run the radiology services at the institution. So really, sometimes they just try to work hand in hand between the radiographers and the clinician, just to try to help the patient with what they can. So sometimes they just manage the patient based on how clinically they presented, without the imaging that they really needed when it's missing. Sometimes they do refer the patients to Queen's Central Hospital for further imaging. It's in rare instances where you've seen maybe a clinician or radiographer calling, consulting for help. So that rarely happens, but most of the times they work with what they have. If it's very tough, they refer them to a tertiary hospital. One of the things that I can mention is that things like ultrasound or X-ray, really, they are basic equipments that a district hospital needs to have, and if we're being fair, they were supposed to have that, at least an adequate amount of such resources to be able to help the population. So if they could be an option where they get supported with better ultrasound machines, the good quality ultrasound machines, or at least maintaining the ones that are there so that they are in good shape, that would be of very use. Another area that I'd thought about is issue to do with mentorship. I'm thinking this is something that should be doable. So just to enhance their knowledge, their capabilities. So these are the things that they already do. If we could have moments where we could provide mentorship to the radiographers on how best they can come up with good imaging, diagnostic imaging that would help in solving patients' problems, that would be good. So just enhancing their already existing skills so that they know what they can do with the available machine to help the patient. And at the same time, also having like CPDs or trainings to the clinicians. So in the instance where they do not have specialists, maybe they should have some technical knowledge on how they can look at the imaging, interpret it, just have some basic knowledge so that they are able to help their patients. So boosting the images, the machines that are there so that they're in good shape, and then providing them with training so that they come up with best images that would help diagnose disease in the patient and boost their knowledge as well. That would be very useful. My suggestion would be helping them in terms of the equipment, and at the same time improving their infrastructure so they have multiple rooms where they can provide the services. So this is a facility where when you go for clinics, you find a lot of patients waiting for the service. So in the instance where you just have one room, one equipment, it takes a lot of time to clear all the patients that have come for the service. So if we could work on the infrastructure bit so that patients are divided, they're going into multiple rooms, there are adequate equipments, this would improve the imaging services at the facility. And at the same time, we could also maybe consider teleradiology as one of the ways to help patients access maybe at least a specialist care. So a platform where they are able to share images, where we're able to discuss and then come up with one agreement about a patient. And of course, talking about radiology and that being run by, say, residents from Kamuzu College of Health Sciences. At the moment, it might not be very easy because the registrars are not in good numbers. So when we upgrading to that step, maybe we would also consider supporting KUHES in bringing in more residents into the program who eventually become specialists in the long run, and they'll be able to support and run such services. Well, for me, it's sort of been a good experience. So I look at where I work, having at least adequate resources, I would say, when compared to the district, and a team that is capable to give me help, to support me when I need it. And then I go to a different perspective, like the district, where there's just a few people on the ground, maybe no one to consult. I've sort of learned, like in our Malawi setup, we need to, at the moment, what we need to do is to adapt with working with what we have. So having every resources might not happen now, but maybe adapting to working with the available resources. So really, this is a lesson that I have learned. It's been also a wonderful experience because it's improved my mentorship skills. When I go to the facility, interact with the clinicians, the radiographers, this has been a good opportunity for me because it has enhanced my mentorship skills. I saw the need, and yeah. From worldwide radiology, it would be very great if maybe they could come in to assist with the mentorship programs. For example, this facility is some miles away from Blantyre, so it requires us residents to move to the facility to and fro. So if they could help us with logistics to run such kind of activities, that would be great. And maybe if they've got any mentorship programs as well that could be of benefit to the district hospital. So that would be also another opportunity that our colleagues from the district would benefit from.